AI may become the standard of care to the point where causing no harm, you'll be causing harm. You'll actually be violating your own oath. Because if you don't use AI, if you think about it, I mean, if it's really going to the point where human error, you're not perfect, you're going to end up making mistakes, that could become the standard care. And when that does, if you don't use it, you're violating your own oath.
Here's a really exciting conversation about post-2020 artificial intelligence and medicine. I can tell you a lot about AI. I have next to zero knowledge of medicine. I've got the fellowship from 2017 at the Institute of Coaching, which is part of Harvard Medical School, but I know we didn't cover medicine or healthcare at all there. That was talk therapy, essentially, coaching for high performers and their families. So I brought in an expert that knows pretty much everything about medicine. His name's Harvey Castro MD. He's led 9 healthcare facilities, including 7 emergency care locations in the United States. And it's not just his medical background, it's also the fact that he knows a lot about modern large language models. So he's played with ChatGPT, he's played with GPT-4, he certainly knows a lot about the other LLMs around there, PaLM and BioGPT, and their applications, the actual use cases in an emergency room. So I had an absolute blast speaking with my new friend, Dr. Harvey Castro. All right, let's start with the most important question, Harvey Castro MD. Where did you get your name? That's such a good name.
All right, well, you're in for it. Here it is. So, long story short, my mom had me when she was like 15, and she went into what's called eclampsia. She started seizing, and she was intubated, for more than 48 hours. So by state law, they had to give me a name. And so my aunt was holding me and said, the nurse came in and said, hey, legally we have to name him. What's his name? And she said, oh, it's Harvey. That's what the mom said. Fast forward, my mom holds me and says, that's not his name. And then, long story short, it took me about 10 years old. I finally went to my aunt. I'm like, why'd you call me Harvey? I'm Hispanic. Like, is it short for some Hispanic name? She's like, no. My best account was this Jewish guy in New York City, and he was the richest person we ever had she was a CPA. And long story short, his name was Harvey. And so I said, well, why name me Harvey? And this was back in the 70s. She said, well, in this world of racism, we wanted to give you a white name, so that way when you would apply to medical school, or not medical school, just any kind of college or application, people would think you're half white. So that's why I'm named Harvey.
It's got such gravitas, though. Harvey Castro MD's in the room.
It does. People people remember my full name, so it worked.
Awesome. So we've covered a bit of your background, including all of your work in the ER, but you've been prolific across the GPT spaces as well. A lot of doctors are a bit standoffish with new technology, and this is bleeding edge technology. It's only been with us for 6 to 9 months in its current form. Tell me about your playing around with ChatGPT and various other incarnations of that model.
Well, I have to give this quick background story. I'm an ER board certified doctor, and I was playing in the emergency room, like you say, and I had a patient actually that came in coding, and I told the nurse, hey, we need to start this IV drip. We need to start it yesterday. And she got this big textbook out, and she started flipping through and was like, okay, I got the dose. And I looked at her. This is when the iPhone 1 came out. I said, no, there's got to be a better way. So I literally wrote an app called IV Meds. It hit the top 10 in the world. And then fast forward, I'm playing with ChatGPT November of last year, and I thought, holy cow, this is going to change medicine. Let me share and play with this some more. And I literally started writing books. And the more I played with it, the more my doctor brain was like, wow, this is going to make huge, huge ripples in healthcare. So then I started writing about it. My wife thought I was crazy because she's like, nobody knows what you're talking about. You know that. And I was like, I don't care. They're going to learn. And then I would tell my colleagues, and they would still don't know. And then even up to a few months ago, some of my colleagues, they really don't understand it. And I'm like, wow, like I need to really help my doctor friends and obviously patients. One of the biggest things I keep telling my doctors is the last thing you want is a patient to show up with ChatGPT output, and they put it in front of your face, and you say, I don't know what this is. I've never heard of ChatGPT. You're going to look really bad as a doctor. People are not going to respect you. So, regardless if you use it or not, you need to learn about this.
I love that. And you've been on the very edge of it. I remember giving a presentation in Brussels, must have been September, October last year, to the developer community. It was 4,000 Microsoft and Google devs. And I said, who here has used Copilot or any sort of programming interface that uses AI to help you code? And only about 50% of the hands in the room went up. This is September 2022. Now, July 2023, we've got stats that say 70% of programmers use a large language model to help with their code writing. And EMAD just this morning from Stability AI said that programming will be over in a few years' time, that we won't have software development as it stands. I think that's really even more applicable in medicine when we've got some of these stats showing up about just how good these models are. It makes sense to put it into the healthcare environment.
Yeah, it's interesting. You would consider healthcare being very conservative to the point where change is rough. Like I always joke that if I want to make a change at my hospital, they have to call the regional hospital, and then they have to call a corporate, and then they have to have multiple meetings. And then by the time they turn around and do it, it's been a year, and then it doesn't matter. Like we've moved on to something else. And so it's very slow moving. With that said, there's this big pressure with healthcare in that the aging population's only getting older. They need more care. And then this was an interesting stat. I read that the average age of a nurse is 54 years of age, and 19% of that is nurses that are 65 and older. So I thought, holy cow, like we're in a crunch here. So if that's the average age, fast forward 10 years, the average nurse will be 64, and that's going to be hard on our healthcare system. And that's just here in the States.
Yeah, look, I talk a lot about augmentation and amplification of intelligence, and I think that's going to be huge at any age. How are you finding the embracing of technology across age groups in ER or in medicine in general?
Yeah, it's funny you say that, actually. I've noticed that my older doctors, some of them have said to me, I'm going to retire if I'm going to have to use AI. Like, I don't want anything to do with it. Then the opposite side of the spectrum, I have doctors that just graduated residency and they just can't wait to use AI, and they're trying to already incorporate it into their daily lives. And what's interesting is some hospitals are blocking them, saying, hey, you can't use this because they're so worried about HIPAA compliance and privacy, which I understand, but they're worried that inadvertently this doctor is going to put some sensitive information into ChatGPT equivalent, and then the fines here in the United States are pretty steep for violating HIPAA.
Yeah, I suppose you're right. It's more important in medicine with all of the compliance, but we still see big companies like Apple and IBM banning generative AI because of that accidental posting of IP, I think is the major concern, which just becomes huge in medicine. There are some platforms already that have played around with ensuring compliance across the board. So you've got Carbon Health was the first that's using GPT-4 along the way with Azure medical transcripts. And then their competitor is Ambience, where they listen to the GP appointment, the general practitioner appointment. I think you call it something else there in America, but your standard doctor's appointment, and then transcribe that. And then GPT-4 summarizes that and links that with the patient chart. So they've increased productivity massively. It's something like bringing a 16-minute appointment down to 3 minutes because you're able to use this large language model. And they have complied with everything they need to comply with. Obviously, Microsoft Azure has got all that built in for HIPAA compliance. What challenges have you seen for ChatGPT across the same query?
It's quite interesting. Some doctors don't know the basic stuff like hallucinations, and some of them are using the wrong GPT. For example, you and I know well that 4 is way better than 3.5, but to them it's just call ChatGPT and everybody's talking about it. Let's use it. And so it's kind of disfortunate for us as a profession because it's being used wrong, and then the heads of certain hospital systems are using it and saying, oh, this is bad, let's not use this, and then they're banning it without really understanding it well. And so I applaud big companies that are able to use it and figure out the HIPAA compliance, because I feel like they will be the leaders to help other developers out there that are wanting to use AI's APIs, for example, to create new products. And I'm really excited because I really honestly think that we just scratched the surface of what these AI models can do in healthcare. The hardest part for us as doctors, I think, is going to be what things can AI do that we don't have to worry about HIPAA? And then what things can we do in AI that unfortunately the FDA can't regulate? And so the minute AI starts influencing the doctor, someone like me, decision process, well, then at that point the FDA can say, wait, this is a medical device. Even though it's not the usual medical device that we think of, it becomes a medical device. So it's a slippery slope because, yes, it can be regulated by the FDA and get approval. But these algorithms, as you know way more than I do, it's kind of like this black box. How does it do it? And FDA wants to show reproducibility and explainability. And if it doesn't show that, and obviously you and I can ask the same medical question and we'll get two different answers. They're probably correct, but they're not the same. And then the FDA will flag it. So it's kind of frustrating. But fast forward, I really do think the FDA is going to make some changes here to allow these algorithms to move forward.
Yeah, it'll be completely necessary. Unfortunately, the red tape and compliance and bureaucracy really does hold us up in the proliferation or at least the integration of artificial intelligence through society and in the areas, the industries, the fields that need it most. I say the big three are education, legal and jurisprudence, and right here in medicine, which I know nothing about, but healthcare is ripe for having this AI either as disruption or innovation or just as amplification. There's the AMA talking about how these GPTs can support practitioners in the field. They're quite open about supporting that. So I wonder just how long that's going to take if there are other bodies, governing bodies, saying we're a bit scared of this, we're a bit old for this.
Yeah, it's interesting because throughout medicine, I'll even give you some serious, interesting things. I remember when I applied for medical school, I didn't have a tattoo. I still don't, but I remember hearing that if you did, you had to cover it, because if the doctors that were part of the profession saw the tattoo, you'd not get in. That doesn't hold true now, but that kind of thinking, if they're holding back just for a tattoo, then they're really going to hold back for AI. And I think it's going to be an interesting thing looking into the future. Some countries, I believe, will adapt AI in healthcare way faster, and they're going to be less stringent as opposed to the United States. For example, I see a future where, I'm not going to pick a particular country, but let's just say a third world country has such a big need in healthcare that they're going to say, you know what, our people need healthcare. We're going to allow this AI to be a doctor within parameters. Whereas in the United States, that same scenario, that won't happen. But I personally think these third world countries are actually going to lead innovation in the sense that they're going to say, this is how we're using it, these are the models, this is the way, and it's going to put so much pressure, example here in the United States, that the population is going to say, I'm paying all this amount of money for healthcare, and here's a third world country that's figured it out. Let's see how we can do it, and that's going to put pressure on the political leaders. And I do think eventually that's going to change things here, but it's going to be a harder journey here in the United States versus third world countries, which you would think it wouldn't be that way.
Yeah, absolutely. I've noticed the same kind of thing, that the smaller countries, the ones that you wouldn't even consider, are able to do things a lot faster. It might be the rapid agile versus the slower moving kind of waterfall methodology. But certainly in my work with government, you've got these small players who have entire departments of AI. They'll push it through their tourism board, they'll push it through their employment, how they're working around with companies. They'll push it right the way through society in their country. Meanwhile, you've got these slow lumbering beasts that are really moving very, very slowly, or setting up committees and making sure that they have all voices heard. I think that's going to be interesting to note the difference between a very small country with a small population being entrepreneurial and countries that are a lot bigger. I've already seen a little bit about that. Let's talk about models for a second and the differences in the models. You mentioned ChatGPT, which has GPT 3.5 as a base, and that came out in 2022. If we compare that with grading on the USMLE, the United States Medical Licensing Examination, I know nothing about medicine, but I know this acronym. It scored 60.2%, so not great. Along came GPT-4 very recently, March 2023, and it scored the equivalent of about 86.1 on the USMLE, which is incredible. This is where the model has taken a new test, and in its training data, we've spoken about this in lots of different ways with the Life Architect content, it's not actually able to memorize anything. So it's not got a database, so to speak. It's not got a knowledge base. It's got the equivalent of neurons and synapses like the human brain. So it can be given a new medical licensing exam and still score up there in the 86th percentile or higher, 86%, with a new test, which is mind-blowing to me. Last month, along comes Google Palm and blows that out of the water. So it scored 86.5 on the USMLE with a fine-tuned version of their Med-PaLM 2 model. Now, to me, it's in your face. It's not even black and white because there's beautiful colored graphs on how all this works, but it's very clear, and they write very clearly that it outperforms humans. Let's leave all the what ifs and the buts and the asterisks and the clauses that say, look, just be careful because it's not testing everything. Some of the questions are from forums. Humans are better, humans are better, humans are better. They want to make that point. Right now, in black and white, it says that current models, GPT-4, Med-PaLM 2, outperform humans, trained physicians that have been to school for 20 years significantly, sometimes 10 times better in empathy, in reasoning, in accuracy of diagnosis. As an AI expert, I go, well, that's even mind-blowing to me. How does that look in healthcare, in medicine?
Excellent question. There's so many parts to that question, but I'm going to start by saying the reason it's called the art of medicine is because it's a true art. The USMLE, you got to remember, these are standardized tests that are just testing the physician on a certain vertical. So it's testing them on cardiology, on pulmonology, and typically these questions are very strict on that one vertical when they ask the question. And so it's what we call textbook presentation. Like this is how the textbooks present. And the reason I feel like it's called the art of medicine is because unfortunately, if you had I'm going to stab at it, and I'm probably wrong here, but I'm going to say, on a given day, maybe 10 to 15% of my patients present with the given textbook. Whereas the other 85 is a combination of the textbook, where they present a little bit of this, a little bit of that, and then the art of medicine and what I call the gestalt, where I go in and say, oh, wait, XYZ, this, okay, it's probably this. I don't think our models are there yet, and I will stress yet. But I think it is in a place in medicine where it's a heck of a tool, because I'm way into my career, probably 20 years out of graduating and plus, and then I thought, man, I'm kind of jealous, because if I was a medical student right now, I would kill it, because there's so many ways of using this AI. I'm going to go in a little tandem here and say every person out there learns either visually or listening or a combination. What if you use the power of AI, and let's just go to healthcare, and I can make my own notes, I can create my own graphs, I can put all that stuff and throw it into a Whisper or some kind of app that will read it to me. And then now, I'm looking at a Vista board that I have in front of me. I can, in theory, plug everything there. And so every day I'm memorizing a different equation, a different part. And so the way of learning has just multiplied so much that I feel like, as a doctor, I'm responsible. Every 30 days, my medical knowledge needs to double. That's so much information out there. And so if that's the case, why not use AI now to help me in medicine? Like you said, how is it being used? Well, number one, like you said, education, but let's put that into education healthcare. I think as a medical student, like I just mentioned, would be huge. And then let's just say I'm out 20 years. It's been a while since I graduated. Well, all this new information, how nice would it be to use like an auto GPT that has access to the internet, that puts everything, I'm an ER doctor, that puts everything in ER and sends it to me every week. And regardless of me paying a subscription to one platform or one journal, why not pay one subscription to everything? And I think that's what's about to happen in a real way for us physicians.
I want to pull up this chart from the Med-PaLM 2 paper because it's been blowing my mind this week. And I want to get your feel from it from an ER doctor perspective. It's the one that shows high quality answer traits. It's Med-PaLM 2 in yellow versus physicians in blue. And Med-PaLM 2 is outperforming the physician 7-1 for reflecting consensus, 5-1 for reading comprehension, 8-1 for knowledge recall, and about 7-1 for reasoning versus the human physician. Those responses, those results have made an exponential leap. So 2020 to 2021, 2021 to 2022, and right here in 2023. I can see this exploding by 2024, and I can't even imagine what 2025 looks like. What's your recommendation for someone who is considering medical school in the next couple of years?
Great question. There's the part of healthcare is a little different than, let's say, picking a great stock and having AI tell me which stock I should buy. You know, if there's a hiccup, if there's a mistake, even those amazing numbers, if something bad happens, people can die or people can suffer. And you can make the argument back saying these numbers are so good that they're beating a human being and their error rate is even lower. But I still feel like, just like when my little kids, I turn off the Wi-Fi in the house, they go crazy. I feel the same thing. If doctors, and that's where I talk about to young doctors, I don't want them to be overly reliant on AI to the point where, let's just say we had no way of using AI, that suddenly they can't be a doctor. I think it's a combination, and I put it in a hierarchy. I think AI is great, but I think AI plus doctor is better. And then I think doctor alone, as this pendulum changes, I think AI will beat the doctor when we start adding multimodality and all the other stuff that we've talked about, I think. But it's quite interesting. What I would tell a medical student or a future inspiring one would be still go, because we still have the other part of it, which is obviously empathy. I understand that surgeons, there'll be robots that can replace some surgeons, but at the same time, there's this trust issue in healthcare, and it's not an issue, it's just something that's there. And I don't see all 100% of the population saying, I'll do it. I think there's going to be some exchange of money, and this sounds odd, but I think it's going to boil down to, hey, I will allow the AI to see me, but this is the price. And if I want to see the human, this will be the price. And you can make the argument that the AI is still better than the human, but there's that intimacy, there's that trust. I read about an article of a machine that's able to take blood out of you, and I thought, as much as I love AI, I hate getting blood taken out of myself, and I don't know if I would trust a machine to take blood out of me.
Yeah, that's a good point. And that's one of like 100 use cases that I can think of, Harvey. You've mentioned how you could use it for IV meds. You've got use cases for conversation. You've got use cases for putting it in the GP appointment room when you're with the patient so it can take notes for you and do the charting. There's the use cases you've just mentioned where maybe humans might be a bit standoffish. And then very recently, you've got entire countries who are saying, let's replace our emergency or non-emergency lines. Here in Australia, we've got 000. When I'm in the US, it's 911. And then in Portugal, they've said that they're going to replace their number there, 112, and 311 for Oregon, where you actually get the equivalent of a ChatGPT or a GPT-4 answering your non-emergency call, taking the question, summarizing that, and then passing that on to a human in the first instance. some of these applications seem concerning when, back to your point about hallucinations and groundedness, we're not quite there with the fact checking. But I love the fact that we're exploring so many different use cases for this augmentation of intelligence.
Yeah. Well, as an ER doctor, I deal with 911 calls or emergency calls often. And I can honestly say we, unfortunately, as a society, are bombarding our 911 system, our emergency lines. And unfortunately, some people don't know what's an emergency and what's an emergency. And the people at the front lines have to triage and say, okay, this is an emergency, not emergency. And to me, it makes sense from a large language model. If you believe it or not, there's always like a top 10 of everything. So there's probably a top 10 number of reasons why people call the emergency room or call for emergencies. If you dissect it out, you could probably, I'm all about the bell curve, you could probably get all the LLM questions inside that bell curve, and it would answer a majority of the phone calls. As an ER doctor, I'm going to give an example a little bit further from just non-emergencies. In the world of heart attacks, every minute it counts. So the longer it takes to open up that blood vessel in your heart, the more that heart muscle dies. And so there's a rule here, and it's usually we want to open that blood vessel from the time you get called within 90 minutes. What if you called 911 and the algorithm identified that this was a heart attack, person was in CPR, and let's just say for argument's sake that it could automatically activate the ER, and even though I may not be the ER that it's coming to, but I'm technically the closest one, so more than likely, again, that bell curve, it's coming to me. So all of a sudden, I'm working in the ER and I'm like, okay, it's happening now. The ambulance hasn't gotten there, but I know they'll probably be here within 15 minutes because the algorithm will say, based on average time and traffic, here's the ETA of this ambulance. Now, if I'm working on X, Y, or if I'm understaffed, I can start making calls saying, hey, I need a doctor, I need this, I need that. The other parts of this with the heart example is, imagine that automatically calling the cardiac team, the team that we have to call anyway. Now they're at the hospital even before the patient has even shown up. Now we can save that person's heart even faster. And so I believe AI, in the right tools, the right algorithm, the right vision, and the right tools, we can do amazing things. For example, not everybody knows basic CPR. What about an algorithm saying, hey, I think my loved one is unconscious, and then just be able to walk that person, and let's just say there's a 5-minute wait. That 5 minutes is crucial. That could be the difference between brain dead and possibly living. And so that AI model to say, I believe you're going to need CPR, we're getting you someone immediately, but start CPR, and these are the steps and these are the things you need to check for, you just saved a life. And so I'm really big on seeing how these algorithms are going to make a difference. Going back to your earlier point about this seamless conversation with AI and you and me, let's say I'm your doctor, how nice would be for me to actually look at you instead of me looking away at my keyboard and you say something and me not catch a cue where maybe you don't feel comfortable with saying X, Y, and Z and your eyes twitch or something, and I didn't catch it because I'm looking away. And then the future of AI, I love, because the camera I'm using today can actually take my blood pressure, my vitals, my hemoglobin, and A1C is basically the average sugar in your body. All that with a simple camera. And so I'm thinking, wow, you have this camera, you have the AI. Instead of me having to document, the other part of documenting is the physical exam. What if the camera already knows that I did my eye exam, my ear exam, it's able to follow my hands? I really think it's going to make me way more efficient, which you already mentioned in that one article, but I think with using the camera to document the physical exam, it's going to even make me more efficient.
You created an entire flowchart on using a GPT for answering non-emergency medical questions. Is this something you already use?
I do. You know, one of my public service announcements out there is I'm really worried about patients using ChatGPT, or let's just call it any AI GPT equivalent, and that they're going to harm themselves. For example, I made that chart because I'm worried that obviously healthcare is expensive. I know doctors will tell patients do not use Google Make sure you talk to a doctor, but patients are going to still use it. And so those patients that they start realizing the power of GPT, they're going to say, oh my gosh, I'm going to start using it as my doctor. And so I made the flow chart mainly as a public service announcement, really just to help patients be careful. One of the things I stress about is not every output out there from a GPT equivalent is can be verified by any doctor. Just because I have these initials behind my name that says MD doesn't mean I'm qualified to vet everything out of medicine, because again, I'm an ER doctor. Because there's so much information out there, I can only stay focused, and that's why a lot of doctors specialize. And so let me give you a quick example. As an ER doctor, if you were saying, hey Harvey, I'm having a cardiac surgery and here's the procedure, and I go through it as a doctor, I'm like, yeah, looks good to me. The science is sound. I think this is the way to do it. But then if you talk to the right doctor, to a cardiologist, they go through the procedure and they look at me and they start laughing. They're like, dude, this is not right. This is not even how we do surgery. Like, no. And so that's my example of how it sounds right from a hallucination point of view from the doctor, but it's not the right doctor. And so I made the flow chart just basically to help guide the patients to make sure that they're doing things safe. And that's my main goal. Because the last thing I was going to say is, imagine a patient self-diagnosing and being told they have cancer by AI. How traumatizing that is. And then imagine going to the pharmacy, going to pick up some places outside the United States, you can just go to the pharmacy and pick up whatever drug, and then taking the medicine thinking you have some disease and actually giving yourself some bad side effect because you're taking a medicine that you weren't even needing.
Yeah, it is one of the most critical fields and industries, I think, in terms of getting this stuff right. A lot has changed in the last 6 to 12 months. You've got Harvard that are playing with intervention or inference time intervention, so they are bringing in more truthfulness and groundedness. We're obviously getting bigger and bigger models that are achieving higher and higher, outperforming humans. We're linking them in with robotic surgeons, as in you've got this embodied, physically embodied AI, like a 1X Neobot or something similar, where it can go and actually be hands-on. All of this stuff is really close. I say it's a few months away, not a few years away. What's your feeling on all of that? So a model that you can trust completely, it's coming up, Harvard and Microsoft are doing the work. A model that's maybe 10 times bigger than the current state of the art, and it's inside something that can actually help you out in real life. So something that's got some embodiment. What does that feel like from your perspective, being neck deep in the medical industry?
You know, honestly, the geeky side of me and the altruistic part of me says this is a good thing, because unfortunately there's a huge healthcare staffing shortage. There's a lot of pressure on, especially in the ER. You cannot make mistakes. So I feel like I'm going to have, let's just call it an aide. I'm going to have either a robot, I'm going to have this fancy algorithm that I can talk to. And I know that sounds weird, but it's almost like talking to another colleague and saying, hey, these are the symptoms, these are the results, you know, what do you think? And then being able to go through and say, okay, that's a good point. And then just having a dialogue to help a patient. And so I'm actually excited. I think it goes to my first example when I was saying, you know, I feel like some countries will end up jumping on ship really quick just because the risk versus benefits outweigh the risk, and they're going to say, let's just do it. And I don't think people are just going to let the AI go and it's going to take everybody's job. I think it's going to be a combination. And again, I think in the world of legal and regulation and lobbyists, it's going to be a while. And that's the part that gets me a little depressed, because I feel like some of the changes can happen in a good way fast, but unfortunately I feel like some of the older associations and groups and lobbyists is not in their best interest, and they're going to hold on tight. But I'm happy to say that I really, really think third world countries are going to promote it, they're going to show it, and then the people around the world are going to say, wait, we need to do this. The other thing that fascinates me about this topic is, you know, we haven't gone to the legal and healthcare AI, but I love talking about this particular example. One of my colleagues, he's an ER doctor, and he said that anybody at his hospital that has a stroke, the AI can actually look at the CAT scan before the human, and in real time can say, hey, this person's having a stroke, and then it pushes that radiology film to be read by the radiologist right away. But the ER doctor gets a text. And so right away they're able to jump on it and treat them as a stroke. And I was thinking, wow, what if a hospital across the street decides they have the money, they decide we're not going to spend the money on this. And some lawyer says, you know what, my patient had a stroke. Had they had this system, they would have saved time, they would have had a better outcome, and maybe they wouldn't have any stroke symptoms today, or may have not died. I really find it interesting. I wouldn't be surprised in the next 6 months that we start seeing hospitals or stories of hospitals not using AI being pushed and it being called in the medical world the standard of care, where we're saying, no, this is the standard of care. And I'm going to take it even further. To your point, these models are getting so strong. What if you not using AI, me as an ER doctor not using it, I get sued? And so I really think we're going to get there sooner than later. And I wouldn't be surprised in the next year or so that we started getting to that point, because it's just such a strong tool.
I was going to compare this with self-driving cars, because you've got full self-driving now, you've got level 5 self-driving, and the stats behind this are just incredible. They measure this in crash rate per 100 million miles. And the human fatalities, I mean, the human drivers causing fatalities are just so much higher than the AI-driven cars, the fully autonomous self-driving cars. And that has not yet made its way through the bureaucracy to say, right, we need to save lives and this is a really smart way of doing it. But I'm sure it will. And in medicine, it becomes even more extreme because you've just got a larger population. You know, we all have health as a facet or an aspect of ourselves, and we have different degrees of being healthy or not healthy. So if AI can help us out with that, why would we lean on a human being, a flawed human being, instead to make the analysis, to make the diagnosis, to find the symptoms, and then to provide a treatment? It doesn't make sense to me, and it's really one of the key applications for integrated AI.
Yeah, it's a strong point, and I agree. I think as a society, we're not there yet, I think, like you made a great point. You're right. The Tesla cars. In fact, I'll add another caveat. If everybody was driving an electric vehicle, we would not need these big roads, because they would be able to talk to each other, and they wouldn't have to keep so much distance between cars. It'd almost be like trains in the highway, and there'd be less traffic jams. And so for big cities, it'd be a big plus. But yet we're not there yet, and it's staring them right in the face. I honestly think the more and more I go through this, I do see the future. I don't know where my iPhone is. I was going to point it, but I do see it where I would have it on my phone. I don't need a doctor in the sense that it's this assistance on my phone. I don't think we're going to be far from that. And I honestly don't see, I see it coming soon where patients are going to I can't afford it, and I'm going to sign off on this, and I'm going to allow it because this is better than not having. I'm going to take this, I like the ethics in healthcare and the bias in this a lot, and I'm going to take it to the next level. What if, let's just say OpenAI could prove that you're going to live longer because you're taking care of yourself better, you have better education in healthcare, and what I call your healthcare IQ goes up. And what if your quality of life is better, and now you can live, let's just say, 5-10 years longer than you would have had you not? But what if all of a sudden OpenAI says, this GPUs is costing too much, we can't afford $20 a month, we're gonna jack this up to about $500 a month. All of a sudden, all these people that don't have, would make it difficult for them, and now they're not gonna live longer, they're not gonna have that healthcare IQ, and that part worries me. And I'm happy to hear your podcast and all the stuff you're talking about, all the different models, because I'm thinking, okay, if that happens with one, hopefully there's all these other models that they're going to start competing and keep those prices low. But I always like kind of mentioning that and talking about that kind of stuff.
I think there's a lot of controversy about that particular organization, OpenAI. I think to a certain extent their leader, their CEO, and their president have both got their heads screwed on properly, and they've both separately spoken about the cost of everything coming down to zero. So that's the hardware for the computers, the making the computers, because it will be made by AI-backed robots, and the model itself, or the models themselves, given that we brought in 100,000 new models in the last 6 months. So that concept of altruism is really important through these labs. And your particular example, the OpenAI example, is really well documented. You've got the OpenAI CEO, we'll flash this up, talking about a concept called Moore's Law, but for everything. So where Moore was saying we'll have these the computing hardware growing exponentially, OpenAI CEO said, well, we'll also have artificial intelligence production growing exponentially to the extent that capitalism, economics will have to be rethought. If everything can be produced for free, what happens next in the world? And I don't have an answer to that. I'm not an economist, but it's certainly an interesting path to go down, and it's a path we're going down right now. What I'm noticing next to you is this gap between the technology being available and the technology being proven and the technology being accepted by 60-year-old dudes in white lab coats.
Yeah, no, you're right. You hit it right on the head of the nail. I'm really intrigued to see what happens, and I love this space, and I feel blessed that I have medicine and I understand AI, and there's so many things that are coming. I'm so happy to see doctors. When I read the Med-PaLM that you mentioned, to how they're using doctors to do reinforced learning. ChatGPT, I think it's indirect in that if I call my ER doc friends and we jump on ChatGPT and we help it, we can reinforce the model. But here's nothing, I don't have stock in PaLM, but here's something that I think they're doing amazing. They're using doctors, clinicians to go through, and it's not just any clinician, it's the right clinician to answer. And you're right, it's going to be tough to beat those models. And then from a memory point of view, the older I get, it's not as easy for me to remember stuff. So I can't imagine a computer. I won't be able to beat it, even at my prime. And so I get it. And that's why I say I think it's a combination. I think you got to bring in the art of medicine with the AI. But it's, to your point again, we need to teach our doctors how to use these tools. We need to teach them the good, the bad, and the unknown. They need to understand, because if not, they're going to use the model wrong. I know you've heard garbage in, garbage out. Same thing in the medical world. If a doctor doesn't know how to use this tool, they're going to use it incorrect and they're not going to get the right output. But if they know how to use this correctly and really explore, wow, I mean, the things that they're going to do. And, I know this is common on LinkedIn, they always say this, but you're going to not be replaced by AI, but it's going to be someone that uses AI. I'm going to take it to another level. I think it's going to be the doctors that use AI correctly are going to beat out the doctors that are using AI incorrectly. Because I think that is the future. And I'm excited to see all this new technology and the multimodality. I'm like chomping at the bit, waiting for OpenAI or somebody to let me upload a picture of an X-ray or upload different information so I can take it to the next level. I know you're not in healthcare, but let me give you a quick example as an ER doctor. If I have a patient that's overdosed and say the ambulance comes in and says, here's Miss Smith, she's unconscious, and here's some pills. I look at the pills and I'm like, okay, she overdosed, but I don't know what those pills are. What if I could take my phone, take a picture of it, and then I say the clinical vignette, which is what she comes in with, and then I take a picture, and now it says, oh, she took Tylenol. And then simultaneously, my pharmacy knows, oh, Dr. Castro has a Tylenol overdose, and he pulls up the weight and age and everything and says, oh, here's the antidote. And so within a minute, I'm already having the antidote into my ER, as opposed to the current way is I have to look up the pill, look at the special numbers, or I have to call poison control, wait for poison control to answer, tell them what I think it is, and then they're going back and forth. And then it just takes forever. But now, this is just one quick example that I gave you. I mean, this is going to change the way I work, the way I do things. And again, I'll go back to saving lives. When minutes count, this is going to save lives.
Yeah, fantastic. And once again, it's a beautiful example because that technology already exists. The visual component of GPT-4, which the public does not have access to, and the visual component of Flamingo by DeepMind allows you to grab, I got my iPhone a little bit closer, allows you to take a picture of anything. And in the public launch, they took a picture of just a drawing of a website and it built the website out for them. but it would allow you to take photos of a pill and, in theory, to be able to say, this is that exact pill of the tens of thousands of options, but to be able to both analyze what that is and then potentially to feed that back into the text model and to provide next steps. All of that stuff is here. It's not like we're saying, wait 5 or 10 years for that technology. They've been playing with this. They've showed this in public this year and are using it internally at OpenAI. We're just waiting essentially to get access. And then after we have access, there's that pause between, are we allowed to use it? Does this have to go through FDA? Does this have to go through the board of the hospital or whatever other red tape exists?
Exactly. I like giving this example. I came up with this example because everything I'm about to say exists. And so imagine waking up at 2 a.m, having some chest pain, and you ask your phone, or let's just say ChatGPT, here are my symptoms. Not that I'm advocating, just play along with this story. And ChatGPT tells you, hey, you're having symptoms, you need to see a doctor. But what if that was tagged to telemedicine, and all of a sudden a doctor shows up and it happens to be your ER doctor that you're going to see, because it does geofencing and it knows that this is the closest ER, and then the doctor at that hospital says, oh, you need to come see me. Well, what if you said a Tesla that's able to drive itself and goes, picks you up, and then when you get into the Tesla, the camera is able to take your blood pressure, your vitals, and in real time sends me that information to me. And then what if in my brain I'm like, oh, this guy's having a heart attack, let's give him an aspirin, and it prints an aspirin while you're waiting in the Tesla, and then you take your aspirin. Then you come in, and I'm just going to make the story short. I say I diagnose you, I look you up and all that, and I use AI to help me get you to that diagnosis. But then let's just say it just ends up being bad gas. I send you home, but then the next morning I give you a prescription for antacids. But let's just say in the morning you go urinate, and then this device is able to look at the data from the urine and send me in real time what's going on in your body. And I'm like, oh wait, we need to change this medicine, and I'm going to change your medicine, and boom, it prints in your place at your home. All that exists already. You know, that sounds far-fetched, but all of that exists. But yet we don't have it. But we're going to have those things coming. You know, this is my favorite example. I actually get chills, and I know that sounds geeky of me, but this is kind of cool. So this hospital out of England, what they did is they took discharge instructions for a 5-year-old that had pediatric asthma. And it was the first time this poor child had asthma. And what they did is they took the discharge instructions that they would normally give the child, obviously the parents, and they fed it into a AI, like let's just call it ChatGPT, and said, hey, how do you talk to a 5-year-old? And so they broke down this adult language to how it would speak to a 5-year-old. And then they took Dolly, that's able to create pictures, and they actually made a coloring book out of it, and they put it all together and they handed it to the child and said, this is your discharge instruction. And I thought, wow, because 5-year-olds don't get discharge instructions, but this discharge instruction is pictures. And I thought, man, now the kid understands their disease process, why they're having asthma, why they need to take their medicine, how to prevent asthma. And now the parents can color and they can talk about it, and I really think the kid's going to be able to take it in, as opposed to, I have had 5-year-olds or older now, and talking to my child, it's really difficult. And so I thought, this is the best way to help using AI and discharge instruction. AI may become the standard of care to the point where causing no harm, you'll be causing harm. You'll actually be violating your own oath. Because if you don't use AI, if you think about it, I mean, if it's really going to the point where human error, you're not perfect, you're going to end up making mistakes. That could become the standard care, and when that does, if you don't use it, you're violating your own oath. I do see, when it comes to healthcare, I do see a future where there'll be a new class of healthcare provider. We have your doctor, you have your physician assistant, you have your nurse, your doctor aides. I came up with an acronym, and I call it the Healthcare Expert Leveraging Patient-Centered Efficiency Resource, short for HELPER. And what I envision is someone that maybe doesn't get a year of training. Maybe they get a short amount of training, maybe 2-3 months, but then they get training on AI and healthcare, and they know enough to be able to take care of their function. And I see that new class of healthcare provider that will come, because there's such a need, and we need to train individuals, but it'll be certain tasks and certain parts of medicine that they'll be able to train them. And I thought that would be a great leverage of using AI and the human to get people out there quicker to help patients. Oh, this is a big one. When we talk about empathy, it's really important to understand, yes, the AI does a great job explaining. One of the problems that doctors have is they don't talk to patients, because when they talk to patients, they use medical lingo and they try their best to break it down to simple terms, but unfortunately sometimes they get stuck in talking medical terms, and a lot of patients don't want to correct a doctor. A lot of times a doctor will say, "Do you understand?" And the patient usually says yes, but they have no idea. And so I think it's important to use AI not only to teach you how to be more empathetic, but actually use it to train you. For example, before the call, I was curious. I got on ChatGPT and I said, what are the top 10 things I should not say to my patient to show empathy? And what are more things I should do more of to show empathy? And it was really interesting because I've been doing this forever, and there were some things in there I'm like, never thought of that one. But again, these are the tools that's going to make me even more empathetic. You know, as an oncologist, they're always seeing patients that are about to die or horrible news. You know, why not have them go through a training? Because you get so much training, but it's real on hands-on. So you're learning from your mentor, you're going through residency, but why not learn it behind doors, not experimenting with patients? In medicine, it's see one, do one, teach one, but why not do all that virtual where you're not really doing it on someone, and then later you practice and you've learned.
Yeah, the empathy one is fascinating to me. The fact that, you know, physicians are humans and they get impatient, but I don't think it's necessarily the doctor's fault. Like you say, the patient may be hesitant or reluctant to ask clarification questions, or to say, look, I just don't get that analogy, or I don't even get that particular technical term. Whereas with ChatGPT, it's got infinite patience. You can sit there and speak with it for hours or days or weeks or months if you want, and it will never get angry or frustrated. It's just always providing this endless feedback loop to you, tailored to you, which I think is huge. We mentioned education and jurisprudence and now medicine. And I think having a personalized conversational partner is on the doorstep. I mean, it's possible. It's been possible for 3 years since GPT-3 came out. But for having one in the home that is a million times better than Alexa or Siri, that is based on this large language model, that can have these almost coaching or psychotherapy conversations with you, can have these conversations about your hopes and fears, can go, look, you're concerned about artificial general intelligence or just AI, talk to me about that. And you can have arguments if you want, but given how patient the chatbot is, it'll be like an ideal, perfect conversation for everyone. It'll be having 8 billion conversations and can essentially do the work that we've been trying to do through Sage on the Stage or taught theory or read the textbook. Instead, you get this completely customized, tailored response and conversation to you.
Yeah, and to add to that point, which reminds me, as a ER doctor, I used to work close to an airport, and I would get people from all over the world. I was lucky in that I grew up in the melting pot. I grew up in New York City, so I'm really sensitive to different cultures and sexes and ways to talk to people. But what about some people that I know, some doctors that haven't left the state of Texas, that really, they've been on the outskirts and they've always been there. And so now you put them in front of different cultures and different beliefs, they don't know how to relate. And I'm not being disrespectful to them, it's just they don't understand. Why not use ChatGPT to customize? We talked about it briefly about how to talk to a child, but the way I talk to an adult that has diabetes for 5 years is not the same way I talk to a diabetic that's had it for 20 years. And so why not really hone in on their discharge instructions, really customize it to their age, to their sex, to their culture, to their beliefs. So that way when I speak to that patient, I'm really talking their language, their culture, that I'm sensitive. You know, one of the things that I know you mentioned before, you were going to say, why go back to med school? Or why should medical students go if AI can do it all? You know, we have to be sensitive. In medical school, I remember getting taught about Jehovah Witnesses, and you can't give them blood transfusion, and these are the different ways to do it. These are all ethical and very touchy situations that there has to be a trust built before a lot of things are done. And so that part of AI in healthcare is going to be tough to replace because these are really sensitive. Now we're talking religion and beliefs on top of just the science. So it takes us to another level, which is quite interesting. One other thing, just real quick on the biases, we've read in the news about AI, some unscrupulous company using AI to talk with patients for mental health and not letting the patient know that they weren't talking to a human being, they were talking to AI. I do believe in the future, or not in the future now, we need to make sure we're using guidelines, especially in healthcare, and that the patient, if that's what's going to happen, that the patient's aware that they're talking to AI. That way they consented that that's happening, not to be fooled. So these kind of technical things, I want to make sure that in the future we put the rules. I applaud OpenAI. I feel like they've done, personally, when I look at all the things that they're doing in the guardrails, I'm happy to see that. When I saw them testify in front of Congress, I thought that was great. I'm actually more worried about the small, large, or different LLMs out there that may not put those guardrails. Or, I remember reading about a kid at a Stanford that was able to create an LLM with like $400 and had ChatGPT train it. And I thought, man, if it's not done correct, a lot of these other companies, they can fly under the radar, and who knows what's going to happen.
Yeah, the safety stuff is so important. And OpenAI, again, have talked about people being able to design their own safety models so that they are essentially customizing it. So you could customize a physician chatbot, and you could also customize a relationship chatbot, and you could also customize a career coaching chatbot. But right now, the safety guardrails make something like ChatGPT a little bit challenging to talk to compared to the raw base models that we had in 2020, 2021. If you had to recommend a book for a patient to read and a doctor to read from your many books that you've written on GPTs and medicine, what would you go to?
I have a book called ChatGPT in Healthcare, Empowering Patients. That one I would give to patients because it really goes through kind of explaining how patients who use it and how it can be used for like nutrition and stuff like that in healthcare, and use it safely. And for doctors, I'm biased. I really like my Bing Copilot and other LLMs, Revolutionizing Healthcare with AI. I think that book, I spent a lot of time creating, just not talking about just ChatGPT, but I've gone into PaLM 2 and Gator and all these other BioGPT, all these other LLMs that are in healthcare. And I think I'm biased. I think I do a good job explaining it and what the future holds. But I know after speaking to you, I'm going to have to add some of the robots to it because I hadn't thought that far. I need to add that, but that was interesting.
They're coming, absolutely. They're here in a lot of ways. Some of them are really confronting, and then some of them, even when you put clothes on and make them look like they would actually fit into a home, it's just still so jarring, coming as a child of the 80s, coming out from all the Hollywood movies that we were shown back then, to actually have it in our houses now in the 2020s is something else. It's almost indescribable.
I'm excited. Do you have any idea what the price will be? Have they said?
Well, the Boston Dynamics one, the Spot one, has a price against it, and the Atlas one, I think, may also have a price against it. I don't know, given that the Apple Vision Pro is about $7,000 here in Australia when it comes out next year, maybe a multiple of 10 for a robot that has a lot of the same technology plus all the proprioception. It's gonna be awesome.
Oh, I can't wait. I love technology too much, obviously, but it's gonna be great.
Are you a reader of the memo?
Yes, I every chance I get. Awesome. Every other week, I would just type in the website in my Gmail to find it, and if I saw it was there, I'd read it, and then find any links. And no, you're doing a great job. I love your work. I'm excited. And every chance that I read it, I always put a healthcare twist in my brain. So I'm like, I wonder if this was in medicine, how it would change. So I was thinking about, all this. There's all this talk about AI. Helping a new drug for fibrosis in the lung. And basically, long story short, it's AI creating drugs. And I thought, oh my gosh, this is going to help people with rare diseases. And let me explain. For example, there's some drugs out there that cost $2 million for hemophilia to cure them, but it's $2 million. So if you don't have it, you're not going to get cured. What if we used AI to make the process get there quicker, get approved faster, decrease the time to market? Now, what if all of a sudden, I'm just making up stuff, instead of it costing $100 million or $1 billion to make, what if you could create it at 10% of that price? Now I see pharmaceutical companies identifying certain diseases saying, hey, this was not profitable, but now it's profitable. Let's go ahead and address it. And so I'm kind of stoked, and I'm going to take that to the next level. What if in the future, and I see this coming, if we combine our human genome plus AI creating drugs, and now you're able to get a personalized pill. Let's just say I have diabetes and it's insulin, but what if it's an insulin specific to my body type that's going to be even more efficient? I mean, my mind just blows up thinking, man, the possibilities, infinity, and it's going to help a lot of people out there.
Yeah, for sure. So Moderna were doing that with the vaccine a couple of years ago. The one you're referring to is in silico, right? Synthesizing drugs for that's very specific, and I love you looking even further out than that, because we've already got tailored and custom approaches with platforms like Vital, where you can have vitamins essentially or nutrients customized for your body type. Take that out to maybe it's just a few months and have complete medication customized to your body. Be fascinating.
Less side effects, better efficiency. Oh, it's unreal. That's why I wish I was like 10 right now.
That was a deep dive into artificial intelligence and medicine and healthcare. What do you reckon? Shall we cover another expert in perhaps legal next, or down in the weeds of education, or something else? Is there another field that you'd like to see? I had an absolute blast with Harvey Castro MD, and it's really intriguing to see how this sits inside an ER room versus how it sits here in my office, going, well, all of these models are available. This technology is bleeding edge. We're making some huge strides. What does that look like in practice? Thanks again to Harvey. I'd love to invite you to jump into the memo. The editions are sent pretty much every 10 days at the moment. It was supposed to be monthly, but we've made the cadence a bit more frequent. And it goes out to paid subscribers nearly everywhere. A lot of the major Western governments. We've got Disney, Cirque du Soleil, we've got IBM, Tesla, we've got NASA in there, we've got the big research organizations like RAND, MIT, the big universities. I'd love to have you in there as well. I provide cutting edge, what is actually happening in that moment. So for July 2023, we're going to catch up on some of the big model releases, as well as the big applications of artificial intelligence for you. See you soon.
Did you see the memo about this?
Yeah, I have the memo right here.
Love artificial intelligence? Excited by the explosive progress of integrated AI? I am. Join my private mailing list, The Memo.
Did you get that memo?
Yeah, I got the memo.
Get priority access to my articles, videos, and behind-the-scenes tips as soon as they're released, with a monthly or annual subscription.
Yeah. Didn't you get that memo?
lifearchitect.ai/memo.
I have the memo.